Hello everyone. Before we begin our session, I want to clear up a common doubt. Many of you might be wondering why we need to learn so many biochemical tests. Will they really help us in clinical practices? The answer is yes. So look at the picture. Here clinician and microbiologist both play an important role in patient management. How? First, correct identification of bacteria in the lab leads to correct diagnosis, then appropriate treatment, and finally leads to better patient management. So look at the picture. It mainly says how the bacteria enters into the human body and cause manifestation of the disease. So it starts with entry of the bacteria into the human body through various routes. One is inhalation, ingestion, break in the skin, genitourinary tract or vector bite. It leads to colonization at the local site, then invasion to the bloodstream, and multiplication leads to toxins and enzymes cause inflammation and cell injury, then spread through hematogenous route to various organs of the body. Then host immune response plays an important role in the fight against the microbes, then leads to clinical manifestation of the disease. So common clinical manifestations are fever, local pain, redness, swelling, cough, sore throat, the respiratory infections, then diarrhea, UTI, pus infections, then sepsis. So early diagnosis and appropriate treatment help to prevent severe complications and limit the spread. So what is the clinical importance of biochemical test? Many bacteria look similar under the microscope and may even produce similar colonies on culture media. All biochemical tests identify bacteria based on their metabolic and enzymatic activities, allowing accurate diagnosis and appropriate patient management. Why do we need biochemical test? First, to identify bacteria accurately. For example, Escherichia coli, Klebsiella pneumoniae, Enterobacter cloacae are all gram-negative bacilli and lactose fermenters, but biochemical tests distinguish them. Second, to differentiate closely related organisms, biochemical reactions separate bacteria with similar culture characteristic. Example, citrate test differentiates E. coli from Klebsiella pneumoniae, that is citrate positive. MRBP test differentiates mixed acid fermenters from butadiene fermenters. Third, to diagnose infectious diseases, correct bacterial identification helps to confirm the cause of infection such as UTI, septicemia, pneumonia, enteric fever, and meningitis. Fourth, to guide appropriate antibiotic therapy. Different bacteria require different antibiotics. Accurate identification prevents inappropriate antibiotic use and helps to combat antimicrobial resistance. Fifth point, to support the epidemiological surveillance. Identifying bacterial species helps to track outbreaks, monitor hospital-acquired infections, and understand disease transmission. Sixth point, to confirm automated or molecular test results. In many laboratories, biochemical tests are still used to verify bacterial identification. Let us start our next biochemical test, that is nitrate reduction test. Today we will learn the nitrate reduction test, a high yield biochemical test used to identify clinically important bacteria based on their ability to reduce nitrate. We will cover the principle, procedure, result interpretation, clinical application. Let us get started. What is the clinical importance of nitrate reduction test? To identify clinically significant bacteria, common nitrate positive organisms include Escherichia coli, Pseudomonas aeruginosa, Salmonella typhi, Klebsiella pneumoniae, Proteus mirabilis. Second, aids in the identification of gram-negative bacilli. It is used along with gram stain, colony morphology, and other biochemical tests such as TSI, indole, MRBP, citrate, urease, and oxidase tests to accurately identify bacterial isolates. Third point, useful in diagnosing bacterial infections. It supports the laboratory diagnosis of infection such as urinary tract infections, enteric fever, hospital-acquired pneumonia, diabetic foot infections, wound infections, bloodstream infections. And last is the tuberculosis. Fourth point, it demonstrates bacterial anaerobic respiration. The test shows that certain bacteria can use nitrate as a terminal electron acceptor when oxygen is limited, providing insight into their metabolic capabilities. Fifth, used in clinical microbiology laboratories, it forms part of the routine biochemical identification panel for many aerobic and facultative anaerobic bacteria. What is the principle? The capabilities of an organism to reduce nitrate to nitrite. Important characteristic features for identification and species differentiation of Enterobacteriaceae family. These features are absent in Pantonia agglomerans, certain Serratia and Yersinia. Also helpful for identification of Haemophilus, Neisseria and Moraxella. So nitrate reduction pathway mainly occurs inside the bacteria. So follow the arrow mark. First nitrate changes into nitrite. Some bacteria stop here while others continue converting nitrite into nitrogen gas or ammonia. The reagents detect only nitrite, not nitrogen gas or ammonia. The requirements for the nitrate reduction test: first nitrate broth, second 24-hour nutrient agar plate containing pure colony of the bacteria. Reagents are most important, that are alpha naphthylamine and sulfonylic acid. So always procedure starts with the pure colony. So take pure colony from the nutrient agar plate, then inoculate the colony into the nitrate broth, then incubate at 37 degrees centigrade for 24 hours. After incubation, add the two reagents, that is reagent A followed by B. So A is mainly alpha naphthylamine and reagent B is the sulfonylic acid. These are the two most important reagents which mainly detect the nitrate reduction test. Then after addition of the reagents, observe the color in the tube. Then interpretation, the development of red color within 30 seconds after adding the test reagents indicates presence of nitrites and represents positive reaction. No color development indicates negative reaction. All negative reactions should be rechecked with zinc dust to exclude false negative. So what is the mechanism for addition of zinc dust in negative reaction? So negative reaction after adding the test reagent may indicate either nitrate have not been reduced to nitrite or they have been reduced to product other than nitrite, such as ammonia, molecular nitrogen, NO, then nitrous oxide and hydroxylamine. As the test reagents detect only nitrite, the later reaction, that is the production of ammonia, molecular nitrogen, nitrous oxide, etc., would lead to false negative readings. To exclude false negative reaction, zinc dust is added to the negative test tube. So what is the mechanism for addition of zinc dust in negative reaction? Zinc dust causes reduction of residual nitrate in the negative test tube to nitrite. So after addition of the zinc, if residual nitrate is present in the test tube, then the nitrate is reduced to nitrite and development of red color. If development of red color occurs, then it indicates the presence of residual nitrate that is reduced to nitrite. So this confirms the true negative test. So interpretation, if the broth becomes red within 30 seconds, nitrite is present, that means the bacterium reduced nitrate. So this is a positive nitrate reduction test. Colorless tube indicates negative result. You have to exclude it is true negative or false negative. We must perform one more step by adding zinc dust. Addition of zinc explains two possibilities. Red after addition of the zinc indicates nitrate was never reduced by bacteria, so it is true negative. Still colorless after addition of the zinc, bacteria already converted nitrate beyond nitrite into nitrogen gas and ammonia. Now we will see that the negative test is true negative. So look at the clinical scenario. A 22-year-old man presents with a 7-day history of progressively increasing fever in a step ladder pattern associated with headache, malaise, loss of appetite, and abdominal discomfort. On examination, he is febrile and appears toxic. His tongue is coated and mild splenomegaly is present. Multiple faint salmon-colored maculopapular rashes, that is rose spots, are noted over the trunk. Blood is sent to the microbiology laboratory for culture and identification of the causative organism. So what is the clinical diagnosis? So chief complaints are mainly step ladder pattern of fever, headache, abdominal discomfort, loss of appetite, rose spot on trunk. So the diagnosis is enteric fever. We first perform blood culture. So blood culture bottle is loaded to the automated blood culture system in microbiology laboratory. Then on the next day, subcultured on the McConkey plate, which mainly showed NLF colony. Then gram stain indicates gram-negative bacilli motility. They are motile. Catalase test positive, oxidase test negative. Subjected to panel of biochemical test for citrate utilization test negative, indole test negative, urea hydrolysis test negative, TSI showed K by A with specks of S2S, MR positive, then nitrate reduction test positive. So now you will perform the nitrate reduction test in laboratory. The nitrate reduction test is not used alone to identify bacteria. Instead, it is interpreted together with colony morphology, gram stain, and other biochemical tests to accurately identify clinically important pathogens such as Escherichia coli, Pseudomonas aeruginosa, Salmonella typhi, and Klebsiella pneumoniae. So, final diagnosis is enteric fever caused by Salmonella typhi. What is the clinical importance? The nitrate reduction test contributes to the biochemical profile used to identify Salmonella typhi alongside TSI, urease, motility, and serological testing. So to conclude with, the nitrate reduction test helps to identify clinically important bacteria by detecting their ability to reduce nitrate to nitrite or nitrogen gas using enzyme nitrate reductase. So students, this was the complete discussion on nitrate reduction test in clinical microbiology laboratory. Please like the video, share it with your friends and subscribe to the channel for more microbiology session. Thank you.